Hello there, it's Christian, one of the gastroenterology dietitians at Bradford Teaching Hospitals. So today I want to summarize what we've done throughout COVID. I want to summarize some of the main learning lessons since March, where I went from an environment of being in our dietetic-led celiac service within our clinics, ordering bloods, helping patients with apps, helping them self-manage, and developing the service, to being thrown into COVID in March, jumping up on the wards, helping out with inpatients, because before I mainly did outpatient work, and now I'm still doing inpatient work, but at the same time we're trying to push a really good outpatient service because there's a big demand for this too. And I think this is one of the big challenges that many services will be having now. They're trying to offer a good inpatient service whilst trying to rethink all the outpatient aspect too. So we've jumped into many different things. We've jumped into virtual consultations. We've done things differently by creating a newsletter to engage patients, and I've also jumped onto YouTube and created an account onto Instagram, and this is why I think it's a really good opportunity to learn and share learning on these platforms. So social media, if you're not on it, I think it's really good for all dietitians, and by all means you can ask me questions throughout there too. So I think before we go into the main learning lessons from COVID and the changes, it's good to have a bit of a background and understand where the service was coming from before COVID. So from December 2018 until March 2020, this service had achieved quite a lot of things. We'd managed to reduce the waiting times for newly diagnosed patients, so it took them roughly 3 months or more to see a dietitian when diagnosed. Before, we'd reduced that to less than 2 months. We'd actually got more than 50 feedback questionnaires from patients who were really happy with the service in terms of how we were managing symptoms and educating them. We'd set up email communication for patients too, and that meant that between appointments, patients could actually email us a question and they didn't need an appointment for that, so it helped them to manage symptoms from home too and issues. Then we also had telephone appointments, so this was not something new for us throughout COVID. We actually had telephone appointments before. Patients really valued them. We had group sessions set up, which made things really interactive for patients. Then we were saving a lot of money too and time for gastroenterologists because we were taking full care of these patients. So we were truly trying to lead the way with celiac disease and in a dietetic way. And we'd actually started to build a patient support group, which was really helpful to help patients manage the diet long term. And we started to engage with Coeliac UK, Guts UK charities that can be really helpful and help patients with this long-term condition. And then we identified other issues we weren't expecting, like DEXA bone scans not being ordered, and we were chasing this and making sure that bone health was accounted for. And all of this helped us come closer to the gastroenterologist, manage symptoms quicker for these patients. And overall, since we were monitoring all these outcomes, we had outcomes for more than 300 patients, we knew what our service was doing and what it could do to respond to COVID, because we were already doing quite a lot of things differently. So then COVID happened, and actually we went through some of the things that most people have gone through. So clinics significantly reduced. I was doing 3 clinics per week. Then it went down to just 1 clinic per week for newly diagnosed patients. And then we flipped things to give them as much information as possible before the appointment to reduce the appointment time. We didn't have group sessions, so again, that's something that put even more patients in the waiting areas. Then we had patients who obviously had to stay at home throughout lockdown, so we couldn't just get them to send back feedback questionnaires on paper as we did before. We had to rethink many different things. And consultants were still prioritizing their list, so they were prioritizing their caseload and sending patients to us, asking us to take full care of more patients. So again, we were expected to continue inpatients but offer a good outpatient service. And then more recently, as some of you might be aware, the BSG has recommended, so they've given some interim guidance for a diagnosis of celiac disease, where before there was a blood test and a biopsy. Now it's just a blood test, and the GP can diagnose and refer to celiac service. So it's a really a good opportunity for us to take leadership in celiac disease with all our dietetic clinics. So what have we done differently to respond to COVID? So one of the main things we've really focused on is making information more available and accessible to patients through phones and homes. So phones for those who have technology, and homes for those who don't have it or don't use it. And actually, I've created this YouTube account. There's a link later. And we were just looking at answering frequently asked questions so we could help patients troubleshoot problems without having to come to clinic. Then I created an Instagram account recently, and we're receiving really good feedback from people, and this goes to show how it can be our service and just anywhere around the country or the world where we can help patients on social media by having more presence on there. We've had Alex, who's in the bottom right hand corner, who he's been fantastic. He's joined as a dietetic assistant, and he has done a phenomenal job with helping create this newsletter where basically patients can sign up and we can send them monthly updates with recipes, with new products on the market, with videos, apps they can download, things that can help them self-manage. And for those who don't use technology, I've been working with Dr. Shah to create this comprehensive 40-page booklet which goes through the full diagnosis and the diet for patients. And actually this can be really helpful before, during and after appointments. It's almost like a one-stop shop with all the information for celiac disease. So again, sharing that information. And digital communication is something we've really tried to jump on too. So I've started using Attend Anywhere, which I think many other areas have used also. We can share labels, we can share our screen with patients to go through presentations, make things more educational and interactive. We've really pushed email communication, and actually we've sent emails to patients after their consultations with a full list of hyperlinks that they can download, so they can download the right app directly. They can go to Coeliac UK, we've created some useful videos so they can watch that, so it enhances the learning and it can help them and they can still communicate through there. And then we swapped our feedback forms from being fully paper to being paper and also online. So we've been using Google Forms, which the patient can fill in online, and then that analyzes the data for us. So it can really help us save time as clinicians. One of the other things that we've been focusing on has been our celiac pathway. So we've now developed, or in the process of developing, a really robust pathway to fit in all this guidance from the BSG and get GPs to refer to our outpatient service. And this is something that as dietitians we need to get more involved with. We need to get more involved with pathways to lead through nutrition, whether it's celiac disease or any other condition. And the last thing we've really been doing has been working with everybody to achieve the overall outcome. And the goal has just been to offer a really good comprehensive service. And I've been working with patient webinars down south, so some Somerset dietitians that have developed a website with loads of webinars for patients. So I've been sharing the videos with them. They have some fantastic information for celiac disease. Patients can watch that in their own time. Then Alex, who has joined us as a dietetic assistant, he's been doing some phenomenal work with these email resources, with the newsletter. He's been helping the whole department, and it just goes to show how we need to work with so many different people to get things going. And I've also started to work with some bloggers. So the gluten-free blogger is one of them. So it's Sarah Howells is her name, and actually I was contacting her. She's giving us some content for our newsletter, so she's always aware of places that patients can shop for gluten-free items online and in supermarkets, new finds, and then we can just add that onto newsletters. So again, we have to think differently, work with different areas, not just our own, not just health professionals, patients and lay people, as much as we can to make things better. So in conclusion, I think we just need to focus on three main things, and that's to make evidence-based information more available to phones and homes, make this as accessible as possible to patients so they don't have to come to clinic for every single problem, and that's going to help us manage our caseloads too. I think we need to keep testing software, apps and technology that can help patients. A few weeks ago I was doing a webinar with the BDA about involving apps and ORCA and their new app library, and we just need to test them and get them reviewed and share our learnings. If they can help patients and they can help us, then we need to do more of that. And I think now is the time to adopt, change our roles and try to go with things that are going to improve our services, but also improve services nationwide and worldwide. We've got to share our learning now more than ever. So I hope that's helped, and I hope we can continue to share all this information to help the profession. I've attached some useful resources here. All of these things I've mentioned through the presentation. There's some links. You'll get the slides after. But again, if any of you have any questions, please do let me know. Thanks for listening, and I'm looking forward to answering some of those questions. Thanks.